Hello, this is Diagnosis Bona, and it's me, Dinara. So today I would like to tell you about my research that I did in Belarus during my internship. It's research about the prevalence of obesity and breast cancer in postmenopausal women. So let's get started. So again, the topic of my research, prevalence of obesity and changes in laboratory parameters in postmenopausal women with breast cancer. So I am as an intern capable engineer, did it, and also thanks to my supervisor, Kishin Mila, and I did it in Grodno in Belarus. So, according to WHO, 2.3 million women were diagnosed with breast cancer in 2022. And breast cancer is the fifth cause of death from various types of cancer. And again, the breast cancer in women, it's as the first place in cancer in terms of morbidity and mortality. Prevalence, according to research, obesity and overweight are risk factors for some cancers. And also independent risk factors for drug resistance, tumor recurrence, and metastasis. In a study in 2016, which included 144,000 women, it was shown that body mass index more than 30 is associated with high risk of breast cancer. And another study showed also that the 5-year survival rate for breast cancer in obese or overweight women was 55 and 6%, while in women with a normal weight it was almost 80%. It was also a big meta-analysis which included more than 100 studies, in which 67 studies showed that there is link between obesity and breast cancer in postmenopausal women. And it's interesting in this research that it showed also that in premenopausal women, obesity will be a protective factor. Um, okay, and in this slide, I would like to tell you how this adipose tissue can influence cancer genesis. And at first slide, you can see it's adipose tissue in lean women, and there it will be more anti-inflammatory factors like interleukin 4, 10, 13, tumor growth factor beta, and also will be a lot of anti-genetic factors like adenopathy, so which prevents to making a lot of blood tubes. And in the second slide, you can see it's adipose tissue in obese women. And here it will be more pro-inflammatory factors like tumor necrosis factor alpha, interleukin 1 beta, interleukin 6, interleukin 8, and chemokine ligand 2. As well as it will be a lot of pro-angiogenic factors like vessel endothelial growth factor, leptin, interleukin 6, interleukin 8, and chemokine ligand 2 again. So, and all these factors lead to growing this cancer, metastasis, and also making a lot of blood vessels in this tissue. The purpose of my research is to assess the prevalence of obesity and changes in laboratory data in postmenopausal women with breast cancer, depending on their body mass index. So this study included 50 postmenopausal women with breast malignancies, and we did make we made two groups. One was BMI less than 30, so it was women with a normal body weight and overweight. And in the second group, it was women with obesity, so their BMI was more than 30. That analysis was made by using the 4D client program and the state healthcare institution. So it was in Grodno Clinic, number 6. And laboratory data and physical examination were analyzed, like BMI, erythrocyte sedimentation rate, hemoglobin level, glucose level in blood plasma. And uh, what result we've got? Um, As you can see, it was among these 50 women, it was 20% with a normal body weight, 34% were overweight, and obese 46%. If we look at the blood glucose level, in group 2, it was higher. It was a 5.4, and in group 1, it was a 4.9. And of course, it's not a surprise because there is a metabolic syndrome, which includes hypertension, obesity, and also diabetes mellitus. And of course, we see much often diabetes mellitus type 2 in obese women. If we talk about hyperglycemia, so we found it in 10 women and they all were obese. And as we can see in the group one, it was none of these um, women with a hyperglycemia. So we found positive correlation between BMI and blood glucose level. Again, it means that a higher BMI, it will be uh, more people with a high blood sugar level. If we talk about hemoglobin, it's opposite situation, and here in a group 2, it was the mean value was 128, and in group 1, it was 135. So, and it means there is uh, higher rate of women with anemia among obese women. If we talk about next value, it's the erythrocyte sedimentation rate. And the study showed that ECR is higher in group 2, which were that 20, and in group 1 it was 14, which again tells us about that there is some role and inflammatory theory of cancer risk, as I showed you in the previous slide, that this adipose tissue in obese women can create pro-inflammatory factors that influence this cancerogenesis. And we found a negative correlation between ECR and hemoglobin, so it was the higher ECR, the lower hemoglobin level among these women with the breast cancer. In conclusion, the results of the study show a high prevalence of obesity among postmenopausal women with breast cancer, with 46% of participants being obese. And in addition, these patients showed significant abnormalities in laboratory parameters such as increased ECR, glucose level, and we also can see that they have more rate of anemia. These findings lead us to think about ways to prevent postmenopausal breast cancer, how we can prevent it. Of course, we have to encourage our patients to lose weight and through exercise and healthy diet, because it will be better not just for their overall health, but also will be preventive factors for not just breast cancer, but many types of cancers. So thank you very much for watching this video. I hope it was interesting and uh, see you in the next video. Bye bye.